Imagine you're laying on a table, naked and exposed. Someone puts you to sleep, takes a knife, and cuts open your body. It sounds like the beginning of a horror movie, doesn't it? But people willingly put themselves in this situation every day. I'm talking about surgery. Some people have surgery to cure a disease. Some people have surgery to improve their looks. And there are a million of other different reasons to go under the knife. Today, I'm going to be talking about a brief history of surgery, some things that could go wrong during surgery, and the benefits and future of surgery. First, surgery has come a long way since it began. Patients used to have to go through surgery without any anesthesia. Imagine going through a jaw removal or jaw surgery while you're wide awake. In order for these surgeries to happen and be successful, you would either have to be strapped down to a table or held down by several strong men like in this picture. In 2019, Clooney, writer of History of Surgery, said that without the ability to render the patient insensible, the surgeon traditionally administered opium, liquor, or hypnosis to alter the patient's mind, rather than alleviating the pain in the body. Then, in 1846, William Morton carried out the first successful surgical procedure using anesthesia. In 2017, Cruz said that Morton removed a tumor from the patient without any pain involved. Another way surgery has greatly improved is cleanliness. Surgeons and facilities were not properly sterilized, and patients often got infections. In 2019, Clooney also stated that doctors would wear black, unwashed overcoats, like this one, stained with pus, blood, and matter from previous surgeries. In 2016, Erickson, writer of This Won't Hurt a Bit, A Bloody and Painful History of Surgery, claimed that in the New Stone Age, surgeons relied on turpentine and vinegar for infection. Clearly that mixture didn't work very well. The first surgery documented was known as trepanning. In 2016, Wiley, a writer for BBC, said that trepanation was a crude surgical procedure that involved forming a hole in the skull of a living person by either drilling, cutting, or scraping away layers of bone with sharp implements. In 2016, Fawcett, writer of Trepanation, The History of One of the World's Oldest Surgeries, said that today this procedure is known as a craniotomy. Just picture being awake and a surgeon with a filthy overcoat drilling a hole in your skull while you're wide awake. I mean, just wide awake. Sounds pretty gruesome, doesn't it? Obviously, this is why surgery was a last resort for both the patient and the doctor. So now that we have discussed a very brief history of surgery, let's move on to a couple of things that could go wrong during surgery. There are several things that could go wrong, even in the simplest procedure, because they all have their risks. First, if you aren't given enough anesthesia, you could potentially wake up in the middle of surgery. In 2019, Robson, an author for Mosaic Science, said that although extreme experiences are rare, there is now evidence that around 5% of people may wake up on the operating table, and possibly many more. In 2017, Penner, another writer from BBC, said that the patients who do wake up during surgery look exactly like this. They often cannot communicate with the surgeon due to muscle relaxants, and most waking events last for about 5 minutes or less. Another danger of surgery is human error. Some people just aren't fit to be surgeons, and even if they are, people make mistakes. In 2019, Commerce, an author for Becker's Hospital Review, said that researchers collect data from 3 adult teaching hospitals with over 5,300 surgeries performed, of which 106 had major complications due to human error. In 2019, Thymer, an author for the Mayo Clinic, wrote that some of these human errors included performing surgeries on the wrong body part, putting in the wrong implant, or leaving an object in the patient. This image is a pair of forceps left inside of the body. And this is an x-ray of a sponge left inside of the patient. Stuff like this can lead to major long-term complications for the patient. So we went over a brief history. We talked about a few things that could go wrong. Now let's move on to the fascinating future of surgery. Most of the time, surgery is greatly beneficial to the patient and has a very bright future. Robots are taking over, which means less human error. This is an example of a surgical robot. In 2019, NORAD, a writer of Medical Device Network, said that over the next 2 decades, they project the development of new improved surgical robots, and with these new surgical technologies, surgeons' capabilities are extending. Another amazing thing that is happening is 3D printing. 3D printing could reduce complications associated with transplants. Nora also said that 3D bioprinting of organs and tissues is expected to be key in the near future. It could also eventually cause a shift from requiring animal and human participants in drug trials and similarly aid with developing personalized medication. In conclusion, when it comes to surgery, there is a delicate balance of life and death, and people choose to go through with it for a number of different reasons. Today, I discussed the history of surgery, the dangers that it has, and the great future that it has. Surgery could go very easily wrong. However, it's necessary and does amazing